Hey youths, welcome to the Psychology Cruise. This is Esprit Talks from CSP, a platform where we live, love, and learn psychology. For this episode, we have Miss Raksha with us. She's a clinical psychologist, holds a MPhil in psychology, and you know what's the best part? She has developed a self therapy app called Mitsu Care. I mean, she's quite the inspiration. So let's welcome her.
Hi, it was so nice finally connecting with all of you. I think it was long pending. And I'm so glad. I'm glad that I'm here.
Thank you, ma'am, for taking your time out to share your
Uh,
experience with us.
you're welcome. I'm more than honored that you guys actually thought of me for this. So it's really nice.
Okay, so let's begin. So, when and more importantly, what got you into clinical psychology?
Very interesting story, but a very cliche story. I think everybody who has gotten into psychology has sometime thought that they wanted to be a doctor. And I also have a very similar story, but it's different that I set out to be a doctor, but I realized that I just couldn't, like I just couldn't do it. I'm sure that if I would have pushed myself, maybe I could have, gotten into MBBS and everything. I cleared at that time it was known as CET, that was MHCET exams. I cleared it not with like a very terrible rank or something. I could have gotten into a very remote part of Maharashtra or some remote part for a private institute or maybe even BDS or homeopathy for that matter. But I just couldn't do it. And I remember that while studying for the entrance exam, when you go to medical entrance classes, right? So the professor there, biology professor there, actually was talking to us about nervous system, and he spoke about the brain, and then he spoke about the limbic system. And I was like, this sounds interesting. Let us see what it is. And then I ended up reading about it. I ended up reading about psychiatry a little bit, जितना तभी समझ में आता था. And yeah, I think that just stuck, and that's probably the reason why neuropsych is my favorite subject also in psychology. So I think that's how I got into psychology, then masters, then clinical psychology. So
Okay, I see. When it comes to things you're passionate about, it's more like you know. I am
yeah,
sure many of our listeners would resonate with the same feeling.
yes, yes, most definitely. I agree. Like it's just that when you know, and then you have to sometimes prove to your family that you know what you're doing.
Yeah,
But I guess it's right. You put it so well. It is when you know, you know.
yeah. About Mitsuke, so I was really awestruck with the idea. Like, where did you got it from? What was the main motivation behind the genius creation?
Oh, Mitsu. I don't know where to start talking about it. Mitsu is actually not my idea. Mitsu is my founder's idea. My founder's name is Amit. Amit has had he was an IIT graduate, IIM graduate, and he has had multiple successful businesses before, but something which is always very close to his heart was close to his heart, and now he's actually in it is mental health because he's had his own struggles with it, and he realized that one thing that really helped him were books,
Okay.
and he has taken like professional help and everything, and he's very open about it, but it was his genius idea of getting self-help in India, guided self-help in India, especially, which has not been done in India before. People in the US have published multiple papers. Like it is a known therapeutic modality there to deal with depression and anxiety, but it wasn't tried in India before. And yeah, and then he reached out to me. He reached out to the head of the clinical program also, her name is Dr. Mrigya Sinha, who works in the US. And then slowly, from a team of 4 people, now we are a small team of 11 people, and it's a startup. And how did I get into this? I think I needed some change out of clinical work. I needed to be away from hospitals for a while, honestly, because I've only trained in hospitals. So I think some change always is good. You need to break certain barriers in your mind. Uh, Truth be told, I didn't think it would work.
Okay,
I really did not think it would work. Um,
but
but
yeah.
it did. It did, and it is working. And it is every day is work in progress. Every single day is work in progress.
So yeah, kind of off topic, but students like me and many others, we think that we'll
Mhm,
become clinical psychologists after completing our masters.
mhm.
Could you explain the difference between a master's degree and an MPhil degree, and what additional training does MPhil provides?
So obviously, there's a lot of debate
बहुत
now.
दिन में बहुत
It has
बढ़िया था.
become masters in psychology also. So, but I'll probably take that later. But right now, as of now, as in March 2024, you still have 2 years that you need to do your MPhil to become a clinical psychologist. Now, a very easy way for anyone to understand this is a parallel with medicine. Okay, because we all deal with patients, we all deal with patients. Very easy parallel to draw. So, just like doctors have this education in a space, right? So they have MBBS, do MD, and they have postdoc and a lot of things that goes in that space. Similarly, for clinical psychologists also, there's a path that you need to follow. Just like how doctors are registered to their community or their associations, or I think it was called Medical Council of India also. So they have then clinical psychologists are also registered under a government body called the RCI.
Okay,
Why is that important to know? Why is RCI so important, and why are like people talking about RCI? RCI is important because when we deal with people with a lot of clinical disorders, it also includes a lot of disability and a lot of rehabilitation that needs to be done for severe depression cases, for psychosis, for intellectual disability, for neurodevelopmental disability. There is so much for people who have stroke. So there's a lot of cognitive retraining that needs to be done. All of those things are clinical specializations, which is not taught in masters. Okay, so if you want to be a clinical psychologist, you need to go through a rigorous training, which needs to be in a medical college where you see patients in and out day and sometimes also night uh, to make sure that someone can trust you with that person, right?
okay,
Where does RCI come into picture? The institutions which provide this training is assessed by the RCI. Are you fit enough to provide this
yeah,
psychological degree? So that's why whenever we pass out from our MPhil, we get a certificate that okay, we have successfully completed. We give that certificate to the RCI, and then we get a CRR number, which is very similar to the medical registration number that doctors get,
okay,
both of which needs to be renewed by continuous education, which is like a professional development that you need to do. So all in all, yes, masters is good. Masters can give you a lot of boost, but for clinical specialization to deal with clinical disorders, which not just encompass like psychological illnesses, it also includes a lot of medical illnesses also. So for that, you need additional clinical training for 2 years in a hospital. So
okay,
that's the difference, and that's why it's called clinical psychology.
okay.
Yeah,
Great explanation. Thank you.
you're welcome.
Also, I understand that there are a lot of questions regarding the new reform in clinical psychology. Like most of
Yes.
us are confused whether the name of program is changed or the entire syllabus.
Okay. I'm trying to like simplify this. I think I've been doing this simplification since last 2 days, but I'll try my best. Okay, let's just say that currently, right now, we have bachelors of 3 years. I'm talking about the old pathway, okay? The pathway that I followed. There was 3 years of bachelor's, 2 years of master's, and 2 years of MPhil, right? So that's 7 years of education for you to become a clinical psychologist. What the RCI, Niti Aayog, and everyone is saying is 7 years too long for someone to be clinically trained and the get out in public to
Yeah.
serve the community because we are very low on staff. We're very low in number as clinical psychologists. Can something be done out of these 7 years so that people, can buck up with their clinical training? Because the clinical training in this regard, in the 7 year thing, only happens in the last 2 years, which is unfair, right? So they had a lot of meetings over a lot of years, almost 4 years now, and finally we have come up with 4 years of bachelor's and 2 years of master's. Okay, so that's 6 years. What they have essentially done is they have broken the initial master's जो 2 साल का होता था 1 साल उन्होंने बैचलर्स में डाल दिया तो वो 4 साल का हो गया और वो जो 1 साल है उन लोगों ने एमफिल के साथ जोड़ के उसको 2 साल का बना दिया है. So the entire training that you would have gotten as a clinical psychologist in MPhil, it's the same training. It's a different name
Okay.
because we can't use the name MPhil. Is
Yeah.
the training similar? Yes. Will the similar training be enforced? And on ground, will we see the same training take place? Questionable because we don't know how the universities are going to get go ahead. But the entire bachelor's honors of 4 years and the 2 years, which is the MSci degree right now, according to the new pathway, everything from bachelor's till they complete their MSci is going to be regulated by the RCI. So remember how I told you that RCI is going to be responsible for choosing out training institutes? So there is a high possibility the conversation is still going on in associations of to counter this, but let's see how final results come out. Currently, the conversation is right after 12th, people will get into an RCI recognized university. So they are going to probably have like a proper clinical treatment from bachelor's, just how medical students have. Their MBBS is a training program. It's
Yeah.
just that in bachelor's, the last year, the fourth year might be a training, जो हम internship बोलते हैं, वो शायद बैचलर्स के लास्ट ईयर में हो जाएगा. उसके बाद अगर किसी को बाहर निकलना है, so their designation will be separate. Again, questionable. We don't know what designation, what is the role, what is the limitation. All of that needs to be discussed. But masters के बाद we are seeing that RCI will give you a CRR number to practice as a clinical psychologist.
Okay. And this is only limited to clinical psychology, right?
Yes, yes. Because clinical psychology is governed by RCI from the very beginning as a training program. Unfortunately, counseling psychologists don't have a, I think they do have an association. It's just that it's not tight enough. And I wish something comes up soon because they deserve an association also. Rather, every psychologist, we just need to have an APA similar to APA in India, which governs the entire psychological community. But till that time happens, I feel that something needs to happen for counseling psychologists also because they are doing such great job. So it needs to be recognized.
Yeah, I
Yeah.
understand. And thank you for simplifying it. It's just a bit confusing.
Yes, yes, it is a lot confusing. I myself read the document at least 4 times. I checked with people. There were so many questions coming in the last 2 days. I still have a lot of questions unanswered because when I am saying something, I need to like vet my sources because I understand if this is going on the internet, there is so much value, right, that I will
Mm.
be providing. If I don't know it, I don't know it. Like I will check, and the best I can say is I'll check and get back.
Yeah.
But that's the best that I can also do. So whatever I told today, I know that I know this. So that's why I can say it. But yeah, it is a lot confusing. It's very confusing. Yeah.
Thank you for guiding us through it.
Yeah. You're
So, yeah,
welcome.
when it comes to degree, diploma in
Hmm.
psychology, the lines are
Hmm.
so blurred. So,
Yeah.
can you please tell us what is professional diploma and how it is different from MPhil? Registration processes क्या है दोनों के, क्या requirements है दोनों के?
So I'm assuming you're talking about PDCP, right?
Yes.
Professional Diploma in
Yeah.
Psychology, right? So even that is going to change according to the new pathway. We will not have a professional diploma in clinical psychology anymore.
Okay.
So in the new pathway, I think after you complete your bachelor's, you are going to get and first year of MSci only. So bachelor's 4 years and 1 year of MSci, then you will get professional diploma of clinical psychology. Tabhi. So that's the new pathway again. Lot of uncertainty. What is the enforcement of that? So let's not talk about that. But here, right now, till the year 2026, 2025, for the next 2 years, what you need to remember is um, for MPhil, it is a 2 year course, whereas PDCP is a 1 year course. Now, whatever you will do in the 2 years has been crunched to 1 year in PDCP, where some subjects are there, some subjects are not there. How are these subjects selected? It is on the basis of understanding whether for an MPhil, when you pass out as an MPhil, you're also an academic. You can go ahead and teach. But in PDCP, you are associate clinical psychologist. You are not a clinical psychologist. So when you are joining a university, maybe you won't be an academician, you are just a clinician. So you will submit all the psychotherapy records, psychodiagnostic records, your training is still there, but it is a reduced training. So in some spheres, there is some limitations, like being an academician or training students because you need a larger training in that space. So that is one of the major key points there.
Okay.
Um, research is also, I think research is not there, but I'm not याद नहीं आ रहा है मुझे अभी syllabus actually PDCP का but जितना मुझे पता है designation wise two things you are an associate clinical psychologist and the second thing is you can't apply for like university positions or being an academician as such. You can go ahead and do your PhD after that, obviously. You are more than capable of doing it. After which, it's a completely different trajectory. Then you become a scientist, researcher, or a researcher, scientist, practitioner, practitioner scientist. Sorry, my bad. Yeah.
Okay. Okay. So, following this, do you
Hmm.
have anything that students must be aware of regards to the changing in new education policy? Anything that we missed out?
यार बहुत सिंपल है नेक्स्ट 2 साल के लिए चुपचाप एमफिल के लिए करो अगर है तुम्हारे पास मास्टर्स डिग्री एंड बाकी सब छोड़ो लाइक इफ यू फील तुम्हारा मास्टर्स हो गया ये साल राइट यू आर डन यू आर गेटिंग योर डिग्री यू वांट टू बी अ क्लिनिकल साइकोलॉजिस्ट यू हैव 2 इयर्स गिव 2 इयर्स का एमफिल का पेपर इफ यू वांट टू डू इट एंड यू वांट टू बी इन दिस फील्ड जस्ट गेट इट डन यू हैव 2 इयर्स कॉन्सेंट्रेट जो है उस पे कॉन्सेंट्रेट करो
Yeah.
सेकेंड चीज ये है इफ यू आर इन द फर्स्ट ईयर ऑफ मास्टर्स राइट नाउ एंड यू आर गोइंग टू पास आउट इन 2025 or maybe 2024 end there wherever start giving MPhil exams you will get an idea practice you will get an idea of where you stand and uh, जब 2025 के पेपर्स तुम दोगे एमफिल के देयर आर हायर चांसेस बिकॉज तुमको ऑलरेडी पता है कि यूनिवर्सिटी के पेपर्स कैसे थे पहले so again higher chances of being in the intake of 2025
Okay.
okay bachelor students need to wait and see what happens. So for bachelor students, I would just say that तुम तुम्हारा bachelor's अच्छे से खत्म करो, internship ले लो, बीच में अगर gap year हो गया तो किसी को कोई फर्क नहीं पड़ता, अच्छे से आराम से तुमको जिधर observership लेना है, जिधर internship लेना है, you want to take some time, think what you want to do in life, do that, no hurry. That is what I'm going to say. because as of now, for bachelor students, I know how much this uncertainty might be killing them.
Ah,
So much of uncertainty. Oh, should I get into masters or not? If you feel that you are in that uncertainty, get into a master's degree. It wouldn't harm. If you have double masters also at some point of time, it is not going to do any harm to you as such. If you feel you have the resources, you can invest. Even state colleges, yes, state universities may, national universities may, if you think you can do your masters and then wait for what happens with MSci degree, then you wait for it. It's okay. Or else you do your masters. Whenever the MSci degree comes out, you will understand कि कैसे कोर्सेज जा रहे हैं, कैसी यूनिवर्सिटीज परफॉर्म कर रहे हैं, व्हाट आर स्टूडेंट रिव्यूज, देन यू कैन अप्लाई.
yeah.
सो आराम से जरा सांस लो, हो जाएगा सब कुछ.
Thank you. That is such a relief.
या
Yeah, we have few questions. You're
यस.
doing something?
नो नो नो, आई एम सेइंग कि सांस लो आराम से, कोई ना, कर लेंगे. Everybody will sail through this. Everybody will sail through the uncertainty. We just have to put our head down and work where we know where the certainty is, because there's always going to be uncertainty. I did not even know if I would get a job after MPhil. So uske baad also there is struggle. That is a completely different thing. So I'm saying that we know something and we don't know something. We know something, put your head down and work. And hard work will never not be rewarded. So just focus and that will happen.
Okay. Thank you, ma'am.
You're
So I
welcome.
was saying we have some questions from our audience and we would love to hear your opinions on them.
Yes, please ask.
Yeah. So the first question is, oh, we already addressed this, but what are your thoughts on MPhil being discontinued?
I am mixed. I mean, the world is going in a different direction.
Like two sides of the coin?
I Yeah, like it's very difficult. Like, see, in one end, I'm a bit sad, majorly because I feel that if, again, there are conditions, if RCI is able to regularize bachelor's course, then I think I'm good with it.
Okay.
But if at all, if it goes to UGC and universities, I'm just so scared for people. That's all I'm going to say. Because अभी पता नहीं इसके बाद मेरे को कोई भी गेस्ट लेक्चरशिप मिलेगा कि नहीं. But I I feel clinicians need to teach clinical psychology. It's a completely different game when you're sitting in front of a client. Like it's different. When you see your professors deal with clients,
Yeah.
it is zero book, like nothing from the book, and you need to know that. Having knowledge is good. Theory always first, always theory, theory, theory. Unless theory पक्का नहीं होता तब तक तुमको कुछ नहीं कर सकते तुम क्लाइंट के साथ. But at the end of the day, your professor needs to be a clinician or at least have someone from the clinical team in the professor panel. कोई एक को रखो, not everybody needs to be a clinician. किसी को तो रखो who is able to teach therapy well and how therapy is replicated into a real life setting.
Yeah.
So, yeah, like I said, if bachelor's is regulated by RCI, then a certain kind of surety comes that at least students who are getting into the bachelor's course in the last year, they'll get a good training.
Yeah.
And that is one thing that's missing. Whether it was in the current old pathway में भी वो missing था, न्यू पाथवे में मिसिंग हो जाएगा अगर वो यूजीसी के पास गया. लाइक नॉर्मल जो अपने स्टेट यूनिवर्सिटीज होते हैं, चाहे वो डीयू ले लो फॉर दैट मैटर, अम्बेडकर यूनिवर्सिटी ले लो, जिंदल ले लो, चंडीगढ़ यूनिवर्सिटी ले लो, दीज आर लाइक यूजीसी इंस्टीट्यूट्स,
Mm.
राइट. That is a little, I don't know how I feel about it. On another way, I'm also glad that थोड़ा इंटरनेशनल स्टैंडर्ड से replicate हो रहा है because internationally you don't have an MPhil degree.
Yeah.
There also you have a bachelor's, master's, and a PSY.E degree.
Yeah.
So maybe it will be easier for people to
Go abroad.
go there or come here, either way. So again, mixed reviews. I don't know where I am. Both have cons, both have goods. We wanted a very nice, tight, regularized system for clinical psychologists and also aspiring clinical psychologists. एक टाइट सिस्टम चाहिए था कि यही है नहीं तो और कुछ नहीं है ये जो बीच बीच में distance learning are coming. People who don't have a history of learning psychology were coming in. They are like closing it and like closing all the nooks and they're like, this is tight. This is what is going to happen, and that's it. That I like.
So the change is scary, but it's also necessary.
It's the unfamiliar scary.
Yeah.
होता
Oh,
है ना तुमको पता नहीं क्या होने वाला है.
mm,
वो वाला scary है.
yeah.
So it's like going to a party that you don't know what the party is about. You don't know why people are happy. You don't know why people are sad. You don't know which song they're dancing in. But it's just that you have to go slowly if you want to be a part of that party for the longer time. It's
Yeah.
just that.
Yeah.
So, yeah, it's an unfamiliar party.
Yeah, I get it. Okay, the second one is good one. Have you ever been emotionally connected to your patient because of their story? If yes, then how did you handle your stress over them?
Interesting. Oh my God, this is going to make me think. Ah, again, like I'm feeling so conflicted right now. Oh my God, I have so many answers. Um, again, conflicted. I have two answers. Like I feel that I don't know if this is a good or a bad thing, honestly, but being very honest here, अभी ऐसे हो गया कि every time which is a sad thing if you go to say, but every time I sit in front of a client and like, तुम ऐसा क्या मुझे बुरा बोल दोगे at this point, which is going to shake my core because I have probably heard worse.
Okay.
And that's sad because I've probably heard worse. And then it becomes even more sad because that person will say something which will shake my core again, which is again a top notch higher than the previous story that I've heard. So I'm human. I will get affected. I have cried in my sessions with my clients. I'm very emotionally attached to them in the session
How do
is the
you
key
cope
word.
with this? Like how you cope with the stress?
I don't see back to back clients. I have a good support system. I take therapy for myself. I have good supervision. I have been trained a lot. Uh, I I don't even I don't even know how many clients I've seen in my life yet. Like till now. Till now, I don't know. And उतना जब training होता है ना, after a point of time, you form your own mechanism to disengage. Sometimes it happens, sometimes it doesn't. That's why supervision is so important, like peer supervision or mentor supervision, talking to your colleagues, very important, very, very important. So having a good support system within psychology and outside of it, both matter, both help. Uh, and pro tip, please, anyone who will be listening to this in future, pro tip, make friends out of psychology groups. Like you need to know everything else about every other profession. Make friends with artists, engineers. Engineers, you might feel a little bit sad because they're earning a lot of money, but engineers, actors, no doctors, data analysts, graphic designers. Just go ahead and make friends with people who are not in the field, because all you will always discuss will be कि इसका ये है, वो diagnosis है, उसका वैसे हुआ, oh please help me with the case, this is where please find someone else. And that helps. I think having conversations. I've stopped reading books of psychology only. मतलब पहले मेरा ऐसा था कि I want to read about this and I want to assess this. One of the books that recently I just remembered of was Palace of Illusions. So उसमें also I used to be like, oh, this is so nice, and like I used to sit and be. अभी तो मैंने like I am going to read a crime thriller. I want to read like an autobiography to disengage.
Yeah,
You need to find those things to disengage. Disengagement doesn't come to you. You need to go because you need it. So it's hard. I have gone through. So let me just tell you about a failure there. Um, I stopped, like, I very on in my career realized that I can't take child cases. I don't take them. I don't prefer working because I love children. Like I love them to bits. Like you can put me in a room full of kids. We are going to have a party. It's going to be so much fun. And that's the reason I don't want to work with kids. Because in my masters, I worked three cases. All three cases were kids, and I can't see them go through pain. I can't empathize. Like it is too hurtful. And especially there was this one child. I completely lost my emotionality. I had to transfer the case. All of those things happened, but I still remember his name, I still remember his parents, everything. But a child who's 10 years old struggling with learning disability or specific learning disorder, sorry, my bad, specific learning disorder, I can't imagine what that child must be going through when he's sitting in the classroom. I don't want to, and I can't. And when I was seeing that child struggle, that was it for me. I was like, चलो पता नहीं क्या करना है लाइफ में, बट एटलीस्ट ये पता चल गया कि ये नहीं कर सकती मैं, तो मैं बाकी आई विल फाइंड इट आउट, आई विल फाइंड. एंड एवरी psychologist has that, um whether they like working with certain niches or maybe they're still exploring, so सबका अलग अलग story होता है. This was my story and I was like, I can't, like it's too difficult, and that is where I couldn't disengage. And I feel that it's okay I couldn't, because at least I know. Now I know, if a child case comes, I'll be like, I'm sorry. I have great, that's why I said that I have such good counseling psychologists as my friends, and they are great with kids. And I was like, wow. And they self-learn. So I'm like, I have them, I have a good network, I will put you with the right people. For sure, don't worry about it. But I can't. So sometimes you can, sometimes you don't. But that's where your supervisor really helps. My supervisor really helped with that case. Oh my God. I don't know what I would have done without her for that case, especially. But, but yeah, sometimes it happens, sometimes it doesn't.
yeah,
That's the nature of the profession.
it could be emotionally overwhelming.
Yeah, like I had goosebumps just while talking about him again because I can see his face, right? And it's just like, but yeah,
Mm,
one of those parts of being in the profession.
yeah. So the next question is, what's your
Hmm.
favorite part about being a psychologist?
Hmm. Interesting. I don't know if that is my favorite part or I have started valuing it more. I don't know. It can be taken in both the ways. Is that I have understood the power of language and plays a huge impact. And I've gotten better at it myself. Initially, I would like to say that I've like मतलब वो सीख के आता है of how to use language, how to say things, when to pause, when to hold yourself back. There is something very interesting. If you're interested in reading about this, there's something known as a writing reflex. I'm not saying writing, I'm saying wrong right. Writing reflex. All psychologists have that reflex. कि नहीं तुमको वो नहीं वैसे मत करो. What you should do, that's writing. You are correcting the person. So I think the most interesting part for me of being in the field was both of them because language matters, the way you say it matters. And that has made me a better friend, maybe. It has made me kinder to myself. Um, but there is so many facets, right? Like in every facet of my life, I think there is so much of psychology involved that it has basically shaped me as a person. So the most interesting part or the thing that I like the most that if you are in the field, get ready to learn and learning never stops. And that's the most interesting part. Like it will never stop. Every time you feel that हाँ पता चल गया और कुछ नया आएगा फिर every time पता है और 50 चीजें नई खुलेंगे अच्छा ये भी हो सकता है अच्छा ये भी हो सकता है अच्छा इसके साथ ये भी कर सकते हैं and it just keeps going on and on and on and on and on. That's my favorite part. Like there's no stagnancy. You'll not feel monotony. Because it's very interesting. Every day is different. Every client, you don't know. Same client will throw 150 things at you, and you'll be like, "Whoa, okay, stop. What just happened? Why are you so happy today? You were crying last session." And then it's so dynamic. It keeps like cut changing. It's nice and it's fun, but extremely exhausting, but fun.
So psychology challenges you in different ways every day.
Yes, yes. If you are up for the challenge
Okay,
and if you
this
like
makes
it,
me more
do it.
excited about being a psychologist in future.
It should it should like rile your nerves up, you
Yeah.
know. There's so many students that I speak to, मैम ये हो जाएगा कि नहीं, मैम मैं कर पाऊंगी कि नहीं. मैं भी उधर ही थी, बट वो क्वेश्चंस जो आते हैं ना दिमाग में, इट्स अ राइट ऑफ पैसेज. मैम क्लिनिकल में ज्यादा पैसा है कि इंडस्ट्रियल में ज्यादा पैसा है, मैं कहाँ जाऊं. वो है लाइक इट इज. मैं बोलती हूँ तुम फिगर आउट कर लो, तुम कर लोगे. इट्स अ राइट ऑफ पैसेज. एवरी साइकोलॉजिस्ट एट सम पॉइंट ऑफ टाइम, एवरी क्लिनिकल साइकोलॉजिस्ट एटलीस्ट, इट्स अ रनिंग जोक इन द कम्युनिटी कि अच्छा नहीं आज का दिन बुरा गया जाओ इंडस्ट्रियल करना चाहिए था फिर. इट्स अ रनिंग जोक. आई एम नॉट मेकिंग दिस अप.
Okay.
सो इट्स बिकॉज एवरी एवरी पर्सन वो एक पाथ है.
Yeah.
वो डाउट, वो इनसिक्योरिटी, वो imposter syndrome, doubting yourself, feeling that you have not done anything for the client, or feeling that you have been the best therapist also. So it's a rite of passage. Everybody walks that path. And if all of this happens, no, then, like I said, keep your head down, keep going. Like you're at the right path. Just keep doing it. So, yeah. Yes.
So we have already talked about this, but
Mm.
what do you see as the biggest challenge for this job? Like the one amongst all?
Fatigue. It catches up. Um, it really does. Today, like for example, today is one of the best days that you have caught me for this podcast.
We have been
Like because yeah, I'm glad for you guys too because मैंने like थोड़े cases cancel हो गए, थोड़े कम cases देखे and everything, you know. So today I'm probably looking more like a little more peppier, but otherwise if you don't take care of yourself and if you're not in therapy yourself, again optional, um, and if like I said, that would disengagement wale jo factors and if you don't find those things for you, it's very easy to miss out on how fatigued you can get and how easily fatigued you can get. Like sometimes वो समझ में नहीं आता. And the difference, that is one point, that is one challenge. I'm still going through that challenge. That is, in fact, that is something that I'm discussing with my therapist also right now. That it's very difficult. Like it's a thin line. I'm still finding it. Another thing is also that, you know, if there is a nice way to put this, but ask for the money. Like, ask it. You deserve it. And you're providing a service. It's healthcare, it is human service, it is everything, but you're not obliged to do anything for free. If you're doing it for free, people will take advantage. So don't. And again, challenge. You have to be assertive, no? And so it is a struggle because probably you came up with that thinking, I want to do good for people, and it always comes. I would say most of the psychologists have that in place. So that is a struggle to ask for money, to justify, keep justifying that, okay, I charge this much because I provide this is my qualification, this. It's exhausting.
Yeah.
So both of them are a challenge. Um, yeah, one personally, one professionally. Yeah,
Okay, thank you.
you're welcome.
So anything you want to add or say to our audience? Anything?
Hmm, what do I want to say? Don't choose clinical psychology because it is fancy, because it's not. It's not fancy. It is a lot of responsibility. It's a lot of work, just like any other profession. Like exactly just like any other profession. Um, there's a lot of work to do in India for people. So if possible, and if you can provide for the country, stay back and work here. There is so much of opportunities for you in India, upcoming ones. Yeah, these are few takeaways. And
Okay.
research, learn about research, learn about statistics. If you don't know, find people, haunt people, put them in a box and tell them to teach you statistics. Don't run away from it. These are a few things that I definitely want to tell.
Okay.
Yeah.
Thank you again for sharing your insights and giving us the clarity about all the aspects. It's been a pleasure to have you on Spirit Talks.
Thank you so much. The pleasure is all mine. I loved chatting with all of you. I always like doing this. And this has been so nice. Even though I actually don't feel that tired, like it's almost what we are almost ending the day. But it is so nice. It was so nice connecting with all of you, and yeah, it was a great experience. Thank you for having me.
Thank you, ma'am.
Thank you.
And we look forward to have more enlightening discussion with you. Until next time, youths, live, love, and learn psychology.
Yeah, whatever theories you are learning are not something that you can definitely just copy paste into your practice. You have to twist it, turn it. Every athlete is different, every journey is different, and it needs to be dealt, closely according to their needs. So you can't really assume like what are their needs. Different techniques like being present in the moment, then mindfulness breathing, then visualization, like trying to visualize yourself in that position, in that situation, then having a positive self talk. These are small different techniques. Communication is always the key. Try to speak out loud that what are you going through, what are your feelings, what are your expectations, and this really eases the tension between that dynamic, that whatever dynamics you're having, if it's a team dynamic, if it's a athlete parent, coach,